Happy New Month and welcome to your program of choice, Health Affair on AIT. On the platform, we focus on public health challenges, issues about women and children with a view to preparing lasting solutions. I am your regular anchor, Ushuomowa Daniels. Our focus this week is on iron deficiency. But first is the news segment.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant health information. The sorry state of our health infrastructure is also a major challenge. On Health Affair, Oshomo Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through relevant information.
Rotarian Omotunde Olaleye, president of Rotary Club VGC, and a supportive team there at the Lekki Conservation Center. They have been busy in the past few days planting trees at various locations.
We are here basically to observe our environmental week, which is a week that we are celebrating globally all over the country and especially all over the world, in the world of Rotary International. This environmental week is a week where all the clubs in District 9110 and other districts in the world goes about to do their tree planting. This week, there's what we call the 7 areas of focus of Rotary International, and environment is one of those areas of focus. So Rotary International is choosing this week worldwide to plant trees. So since last week, different clubs in the district have been, going to different locations to plant trees. We did one yesterday. We went to 3 locations to plant trees. This is the second day. You know the importance of planting trees. You take oxygen from trees. It provides shelter, and even in the olden days, when people go to war, you see that when they want to fight their enemies, some climb on top of trees and target the opposition. So planting trees have come a long way to provide that succor to human beings in terms of shelter, in terms of wildlife, even in terms of food. Some trees provide food for nurturing. Some trees provide shelter for people. It beautifies the environment, and it protects environmental degradation against erosion.
We've embarked on a 3 days tree planting ceremony. We started yesterday. Yesterday we planted in health centers and in schools. We planted the health center because of the same reason. We want the place to be well ventilated. We want mothers to sit under shades. We want oxygen, fresh air around the hospital, to at least to drive off or to blow away some disease that mingles with the air. And also in schools, to give the children the same thing: good ventilation, good oxygen, and to give the children a future of tree planting habits. In Rotary, believe that we should catch them young. So as they are growing up, they will be able to know that they need to plant trees around the city, in the villages, and everywhere.
One of the trees we're planting here at the Lekki Conservation Center is known commonly as the neem tree, but its scientific name is Asideracha indica. It is a plant that is indigenous to India, but it is in Nigeria here, and it has become a plant that is known for its medicinal qualities.
Beyond environmental preservation, another vital area of focus for Rotary Club International is disease prevention. This they have done religiously for years.
We've managed to eradicate polio in Nigeria. So now we are going into malaria and other diseases. We've done cervical cancer vaccination for students in secondary school. We want to catch them young and stop the transfer or kill off the cervical cancer. So we are doing it young for children the age of 10 to 14 years, so we can immunize them and protect them from having cancer in future.
We've invested money in upgrading, equipping, and renovation of hospitals. We've sponsored healthcare services. We've built hospitals. One of our projects in our club this year is to kit pregnant women in different maternity homes. We've spent money treating people against all forms of diseases prevalent in the world.
Done with the tree planting exercise on Saturday, 29th of July 2022, the president appreciated his members, who later dispersed to reconvene the next day at the Swiss International Hotel VGC for a seminar. In attendance were critical stakeholders in the environment sector.
We have all seen now from our presentations, the two presenters let us know that the earth is like our baby, and the earth even talks. They talk to us. You understand? If the earth is dry and it's hungry for water, we can see it, it will crack. So you will know that you have to take care of it. We also know that trees give us oxygen. So some people think that God just conjure oxygen. No, God has put trees in place. When they are blowing, they blow oxygen to us. They blow away our diseases that is in the air. Now that fumigation that we do every time is dangerous. So we need to know the chemicals that they are using, the effect on the ground, because they said it affects the ground. So we also have to ask questions from the people we buy our chemicals from. Some kill our pests, some kill human beings.
We go outside the country, we visit developing countries and developed countries, and we see how clean those countries are. So it didn't just start today, it didn't start yesterday, it started many years ago. Those are the prices that people have paid in beautifying their environment. We talk about flood in Lagos and every other part of Nigeria, and we blame the government for flood, but we fail to realize the fact that when you finish drinking water, you don't drop that empty bottle in the gutter because it goes to block the gutter. So government is actually doing their own part. On our own, we should also try and do our own by maintaining cleanliness and make sure that we live in an environment that is clean and free of degradation.
The environment is number one unit of production, and so also the environment is our mainstay, is our life support system. So if our life support system is not healthy, we will not be healthy. And we are the ones who have the responsibility to make it healthy, so that in turn it will take care of us.
Rotary Club International is a humanitarian service organization with over 1.4 million passionate individuals worldwide working to impact humanity positively. It was founded by Paul Harris in 1905 in Chicago, Illinois. The 2022-2023 presidential theme is Imagine Rotary. The theme challenges members to dream big, take action, uniting to work towards global change.
Inflammation of the liver that is caused by a variety of infectious viruses and non-infectious agents, leading to a range of health problems, of which some can be fatal. There are 5 main strains of the hepatitis virus, referred to as types A, B, C, D, and E. According to the 2021 Viral Hepatitis Scorecard by the World Health Organization, an estimated 998,000 children under 5 years in Nigeria are chronic carriers of hepatitis B antigen, while 11,679,000 are chronic carriers of viral hepatitis B. In about 19 countries, more than 8% of the population is infected with hepatitis B, while in 18 countries, more than 1% of the population lives with hepatitis C. The hepatitis B virus can be transmitted from mother to child during birth and delivery, as well as through contact with blood or other blood. The hepatitis B virus can be transmitted from mother to child during birth and delivery, as well as through contact with blood or other body fluids, during sex with an infected partner, unsafe injections, or exposure to sharp instruments. According to the WHO Regional Director for Africa, Dr. Mishido Moeti, Africa accounts for roughly 70% of all hepatitis B infections worldwide, and he called and encouraged for improved vaccination measures for all African children. The National Agency for Food and Drug Administration and Control, NAFDAC, has secured a judgment of 3 years jail term against the falsified drug merchant at the Federal High Court, Kano State. According to the NAFDAC resident medical consultant, Shayo Akintola, a 41-year-old man, Innocent Okbara, was sentenced to 3 years in prison with an option of 200,000 naira fine for endangering lives of innocent customers through the sales of fake drugs. Okbara was also prosecuted for illegal labeling of quinine sulfate and nivaquine chloroquine in a manner that was false. While commending the judiciary for the judgment, intended to serve as deterrent to other criminally minded fake drug peddlers, Director General NAFDAC Professor Mojisola Adeyeye reiterated her call for a review of the law to discourage Nigerians from going into this illicit business capable of compromising the health of Nigerians. Adeyeye pledged that NAFDAC would continue to ensure that those dealing in fake and illicit drugs in the country would not go unpunished. Adeyeye pledged that NAFDAC would continue to ensure that those dealing in fake and illicit drugs in the country do not go unpunished.
A pocket of monkeypox cases have been recorded across the country since the declaration of the disease by WHO as an outbreak of public health concern. There has also been an upsurge in the number of COVID-19 cases, Lassa fever and fears of Marburg virus that has been reported in neighboring Ghana.
We have cases even in Lagos here, and we know that for diseases of infectious origin, we have our isolation center at Mainland Hospital, Yaba.
To know that once there's fever, once there's rash, it's important that we report it, and those that can take charge, that in charge of the epidemiology and then communicable diseases would do that. Of course, the isolation center is also available to be able to take it out of the population and reduce the spread.
I don't think we should wait until it becomes everybody's problem. The government is doing enough. We need to enlighten people.
People to continue the universal prevention, which is protect yourself. As much as possible, we must still try to remember, put that at the back of your mind, that what is most important in this issue, in all infectious disease, is protect yourself.
In the face of the already abysmal health indices, the continuous brain drain of the nation's workforce is further worsening the outcome and leaving behind a huge gap in meeting healthcare needs.
We need something that they are looking for outside to be here, so that they will have no need to go. We need them here more than they need them outside. That's the truth. And if here is where we want to develop, if here is where they have been trained, here is where we think their services are needed.
Isn't it a kind of a shame, like in an environment, we don't seem to place our priority well. We are talking about depletion in workforces. We're talking about migration of our healthcare workforce. Yet, the schools that produce this healthcare workforce, we're also allowing ASU strike to affect them, which means we are not producing, we are losing the healthcare workforces. Our citizens are the ones suffering for it.
You and I know that the prescribed figure is 15% to health as budget for every nation. But Nigeria is still hovering around 5 to 6, 4 to 6, almost every political dispensation. So we felt that it's very important to bring to the consciousness of those to be the new leaders by the year 2023 both at state and national level, to begin to see how to move towards achieving the 15% health budget, and to also see how to move towards universal health coverage in another better manner.
Addressing the poor health insurance coverage was also highlighted if Nigeria must realize the universal health coverage goal.
Have an authority, different from a scheme. You and I know the simple definition of what an authority means as power. And when there's an authority, it means that we have it today, the NHIA almost looks like what we call a sole administrator of health insurance business in Nigeria. And what that means is that health insurance is now health insurance is now mandatory. If you don't have an health insurance and you are walking or breathing air along the streets of Nigeria, you are breaking the law. You are breaking the law, and the penalty may just be as clear to you and I as it is just like a driver driving a vehicle without a driver's license. So automatically people should come in. And in fact, because of our economic weakness, let me put it that way, according to the Lancet report, about 83 million Nigerians are vulnerable, and they were so poor that might not be able to pay the premium. The federal government has promised to pick up their premium.
The scheme have just deployed the renewal system. Now you can renew automatically. You remain with the facility, but just ensure that you renew before it expires. So we have other programs that we call organized private sector for people who are working in a formal environment. And this will allow you to come in, not only you as the employee, but your dependents, spouse and children, maximum of 4 that are below 18 years of age. But there is a contribution of premium. Both the employer and the employee will pay. For OPS, which is organized private sector, they are entitled to pay 15%, 10% employer, and 5% employee. Just as it applies to other civil servants. We are public sector employees. We are paying. I'm contributing in NHIA for me, my husband, and my children to be covered. But right now, because my children are above 18, it's only myself and my husband that are there. The advantage, again, of coming under the OPS is that apart from you, the employee, and your husband and 4 biological children, you have the advantage of having what we call extra dependents. But this is not going to be paid for by your employer. It will be paid by this employee. And the people that qualify for this is your father or your mother or your children. Maybe if you have more than 6 children, or 4 children, sorry. If you have more than 4 children, those additional 2 can come in. And here, age does not count. You may have a child that is 20 and above. That child can come in an extra dependent. And this attracts just 15,000 naira. So that's the advantage for those who are coming under organized private sector. The benefit package is quite comprehensive. It gives you access, like I said, to 3 levels of care, primary, secondary, and tertiary. And then it gives you 21 days cumulatively in a year for admission. And it gives you access to consultation, to investigation for the areas in which the benefit package covers. You don't pay for them. And of course, drug prescriptions. When you are collecting drugs from your pharmacy, you are only entitled to pay 10% co-payments. I know most Nigeria will ask, why are we asking for 10% co-payment? This is just for us to put a control on the user who is accessing that care. Because there are situations where Aisha will take a card of Elizabeth to go and access care. But when we ask you to pay 10%, you will know that something is coming out of pocket. Then you realize that I should keep my card. So the 10% is just a token. For instance, if you are prescribed drug that is worth 5,000 naira, you are only entitled to pay 500 naira. So that's the only time that our enrollees.
In the past 9 months, under the Agent for Citizen-Driven Transformation Project, titled Building Capacity of Civil Society Organization to promote uptake of justice-related social services in Ojo and Oshodi Solo local government areas of Lagos State, the Women's Rights and Health Project has been working concertedly on how to curtail issues of gender and sexual-based violence in the area. So far, they have been able to build the capacity of 414 community stakeholders to effectively report cases in their communities. The purpose of this recent meeting is to create a platform to track project deliverables and ensure that project objectives are achieved.
The Protection Against Domestic Violence Law enacted by the Lagos State government, and this has been brought to schools and even at the community level, so people are more aware and they're able to speak out. Although the cases are actually increasing, but we know that community efforts are still ongoing, and they'll gradually actually reduce as the time goes on.
Domestic problem, child abuse, all those stuffs. So if programs like this can be something of frequency that can come up so many times, I think people will desist from their normal and the bad way of life they were.
We need to continue telling them, like we that we're here now. Sure, you understand? When we get home, we call our people and tell them, when this thing is happening, if you see, maybe you see somebody cheating a child, treating them madly, wrongly, you call somebody attention and say, look at, you know, if that person is not capable enough to take the case, somebody else will be capable. Sure, you understand? So that person will take the fellow to the police station, or, you know, to report to somebody that can do more than what they can do.
Take our own, we be patent for all the things that happen. If we patent, and if anything happen, let's say husband and wife, if they are fighting together, the husband should give himself a patent and go out for his wife.
Project is championed by the European Union.
I have done my car for full body work.
Madam, look, we will shine this car.
Wait. This cough doesn't sound good at all. What are you doing about it?
Oga doesn't want to go to the hospital so that they won't say he has COVID-19.
No, now. Cough is a sign of different infections, including tuberculosis. You would only know which cough it is if you go for testing.
Kai, I've been coughing for more than 2 weeks now.
There's no need to fear. I have done this test myself. To know the right treatment for the particular cough you have, you must first get tested.
Oga Chekamo, make you dey sure, because
who no go, no go, no.
Check that cough for tuberculosis.
If your cough is more than 2 weeks, it could be tuberculosis. TB tests and TB treatment are free. Just call the National TB Hotline on 3340 for information on where to get the test. This message is brought to you by the Federal Ministry of Health with support from the American people.
Welcome back. Iron deficiency is a condition where there are few red blood cells in the body due to shortage of iron. The body uses iron to produce red blood cells to transport oxygen around the body. When a person is deficient of iron, it can feel tired or suffer from anemia. More than 1.5 million cases of anemia due to iron deficiency are recorded annually in Nigeria, and many people die from the condition due to ignorance. I spoke with a nutritionist, Dr. Choma Onwanchuku. Please take a listen.
Yes, people always think that iron is what we use to iron cloth. You know, there was a video that we did on the street just to get people's feedback. And we saw that quite a number of people don't really understand. Some think it's the iron that you use to iron cloth, or maybe iron, you know, that the welders use and all that. It is an essential mineral, you know, that is gotten in foods. And it is very important because every cell, this number of cells we have in our bodies, each and every one of them, both the brain, every part of our body needs iron. So that is why it is very, very important, and we need to give it some level of attention. In Nigeria today, in fact, the world all over, iron is the most common micronutrient deficiency. Iron is actually a major constituent of hemoglobin. And this hemoglobin is what gives the blood its red color. And the major content of that hemoglobin is iron. It's this hemoglobin that carries oxygen to different parts of the body. When iron is not available, the hemoglobin cannot carry, oxygen to different parts of the body, and the body cannot perform its functions. Our body has a lot of activities that go on. You see, cell replication, goes on every time, and iron is very key to all these processes.
Dr. Choma, how can a person know that he or she is deficient of iron, and how can people replenish their iron level?
Yes, iron, like I talked about energy, when we don't have energy, oxygen cannot even be utilized in the body. And, you know, it shows up in different ways. Like you rightly said, some people would think it's work exhaustion, some people would think it's malaria, which is common to us, some people will just call it stress. But when there's not enough iron, there's this unexplained tiredness. The person is always tired, and there's lack of concentration. You know, the person cannot really hold discussion for too long, can't engage the person for too long because there's not enough iron in the person's system. That's also why we need the support of our medical people. You know, first of all, prevention will always be better than cure. So when we take the right kind of food, when we eat adequately, you know, the body works properly. But when it is not done, and then people start having some of these symptoms like you know, excessive tiredness, like in extreme cases you see the person pale, you see and when they do some analysis they see that the hemoglobin level is low. So these are all signs. At the early stage it might just be that dizziness, that tiredness, and all that exhaustion, that lack of concentration. But at extreme cases you see that the person looks pale. If it's a child, you will pinch it, you see that that area is pale, and the color of the skin and all that. So that shows that. But at that point the person needs to get more attention from the doctors.
So how can people get their iron replenished if they are deficient of this vitamin nutrient?
Okay, I would like to start first by talking about how we can even live a normal life and not necessarily fighting iron deficiency, anemia. If people eat the right kind of foods, you know, if they eat iron, actually we have the heme iron and the non-heme iron. The heme iron, we get it from animal sources, you know, but the non-heme iron, we get it from plant sources. We have iron, we can get iron from beef, liver, although in pregnancy we also need to manage the liver source because of high vitamin A content, so the baby is not affected. So the heme iron you get from beef, liver, chicken, and all that. We get from fish and all that. Then the non-heme iron you get from spinach. You know, our green leafy vegetables, they have quite a lot of iron. We also have things like beetroot, you know, has iron. And but the thing is, for iron to be very available in the body, there is need to have vitamin C. So vitamin C helps in iron uptake so that the body can make use of it. Otherwise, yes, the iron would have been taken in, but the body will not absorb it and make use of it. Apart from the heme and non-heme, we also have cereals that are fortified with iron, you know, and that's why food manufacturers are very important, because we have infant cereals, we have all family cereals, we have beverages, you know, that iron has already been included, they have already been fortified with iron. So it's very important that people read food labels. So when they read food labels, they know what that particular food they are buying has to offer them. So when one is diagnosed of not having enough iron, then it depends on the level. So for some level, it will be correction of the meals the person takes. You know, so if the person was taking the wrong kind of foods, can now be more intentional about getting these foods that have iron, like I earlier talked about. But in more severe cases, the doctors will decide other treatments that can be given. Sometimes it may even lead to blood transfusion. So when there is blood loss, either through accident or through normal menstruation or through giving birth to a baby, there is blood loss. So a lot of
the iron in the blood that will help the body would have already been lost through the hemoglobin that is also lost with the blood. You get what I'm saying? Yes. So with that, the blood volume and the iron in the person's system has already come down, and there is need for a replacement. I'm an advocate of prevention. That's why I like talking about nutrition. So when they eat the right kind of foods, you know, if the degree is not much, they can replenish the iron. See something like ugu. That's our own Nigerian vegetable. It is, you can get you can get 200, you can get 100. I'm just saying 200 now because of the way things are skyrocketing. So you can, you know, but it's for the person to know this is how much I have and this is what I can afford. So they don't go for those ones that are highly priced. In terms of fish, there are some fishes that you can get, you know, at a cheaper price, and the person just goes for that. But it's for the person to know that these are the things he or she needs to eat. Then for the fortified foods, in fact, I want to really thank the ingenuity of manufacturing companies. You know, you see some foods that are just for one meal. So even if the person lives for a day, I mean, earns daily income, some of them you can get for 100 naira. Do you get? But it's just for us to look at it and be sure, this infant cereal I want to give to my child, does it have iron? This family cereal I want to take, does it have iron? And that will really guide them on their choices. If you cannot get there are different sizes. If you cannot get the very big pack, you can get the moderate, or you get just for one meal, single serves. They are all out there. Be your own doctor. Eat right. Okay? Be guided by all these things we have said, and ensure that there's something we call healthy plate. Healthy plate, you know, you have half of your plate made of, vegetables. Then you have the other half, the 1/4 made of staples, maybe rice or something. Then you have the other one of protein. So these are the things that will guide us. If the person is a younger person, you know, you now tweak it. So when we eat right, to a large extent, we will be eating across, you know, the board and get things that will help our bodies. So another thing that will help us, you talked about, there was a time you mentioned about a balanced diet or something. That balance is there's still a big question. But what will guide an individual, when you look at your plate, the more colors you introduce to your plate of food, the more nourishing, let me use the word nourishing or adequate than balance. Okay? So if you have a plate and you have rice, and you bring some slices of tomato, maybe just one slice of tomato or something, it brings a red color. Then you have little ugu that you have, chopped and then added onions. It brings green color. Then you would have a fish, you know, or meat or something. It brings meat. It brings brown color. So you see that the plate is colorful. So if we eat like that to a large extent, we will be our own doctor.
What role does blood tonic play in our lives? Yes,
the role blood tonic plays is like blood tonic that have iron. It's just to supply iron that the body can use. Do you get? The iron that we also help to form the content of the hemoglobin, to strengthen the body to be able to carry oxygen to the different parts of the body, to the muscle. Like as I'm raising my hand now, it's energy, it's oxygen that has, you know, that the body has taken up, that is helping me to raise my hand. As I'm talking, assuming I cut off all those, I cannot do these things. We take it for granted, but these things are, processes that have taken place in the body that enables us. And if iron is not available, the child cannot grow, cannot develop well. Even the brain of the child cannot develop well. And the thing about this iron is, when we do today, okay, the child is still walking and things like that, and there is mental deprivation. I mean, as in the retardation. The child will grow up there's iron deprivation. The child will grow up being mentally retarded. And it can lead to other, you will say, why is he not passing an exam? Why can't he think? Why can't he do this? Why can't he lead? Why can't he do what other? The person is already retarded. The person doesn't have the capacity. Because while the person was a child, these things were not laid, they were not made provision for. So you cannot force the child. Because if one is, you can catch up, but when the brain doesn't have what it takes, you cannot catch up.
It was nice having you on the show. Thank you for speaking with us. We appreciate you. If you're just joining us, it's Health Affair on AIT. And next on the program is our nutrition segment.
It's a common saying that you are what you eat. This is why we make it a point of duty to give you information about food items, fruits, and their nutritional value to help you make healthy choices on our nutrition segment every week. We welcome adverts from food and beverage manufacturing companies on this segment.
Beetroot is one of the healthiest vegetables. It is the taproot portion of the beet plant, mostly grown for its edible taproots and leaves. Beetroot, also known as blood turnips, apart from being used as food, is a medicinal plant that has been used for ages in the treatment of numerous conditions. Though beetroot comes in different colors, red is more common. They can be eaten raw, as juice, or eaten as salads. The health benefits of this wonderful plant has been widely researched. Beetroot, due to its low sodium, fat, and high folic content, supports mental and emotional well-being. Beetroot, according to experts, may delay signs of premature aging. It can promote skin, liver, and brain health. It is beneficial during pregnancy. It lowers blood pressure, reduces the risk of heart diseases, aids in cancer prevention, helps fight inflammation, reduces bad cholesterol, levels the risk of diabetes.
Please come with me to our clinical segment for tips on healthy living.
In Nigeria as a whole, 8 out of 10 neurological consultations or neurological emergencies in the country are as a result of stroke. 8 out of every 10 patients that goes to see the neurologist for an emergency is as a result of stroke. Stroke, as we know, occurs, especially in our society, as a result of a couple of risk factors, things that can predispose to stroke. That's what we mean by stroke risk factors. Chief among the stroke risk factor is hypertension. Like in our environment, hypertension is very high. And then even those people who are hypertensive, a lot of them don't even know that they're hypertensive. For those who even know that they're hypertensive, a large chunk of them are not receiving treatment. For those people who are even receiving treatment, a large chunk of them are not even controlled. And then our belief system also affects some of the things we do. Like for those who are hypertensive, a large chunk of them will also stop their medication and say to themselves that, well, I've been healed by faith, or I'm taking something else like native medications. So when we have uncontrolled hypertension, or hypertension that is there that the person does not know, is one of the cardinal things, risk factor, one of the major risk factors that will cause somebody to have a stroke. We also have diabetes. Diabetes is also on the increase because, of course, our lifestyle has also changed. We are more westernized now than we were before. We eat a whole lot of junks. We take a lot of fried food. We can finish a lot of red meats, fried food. So all of this predisposes people to diabetes, and diabetes by itself also is a risk factor for stroke. And then the cholesterol issue. People who have high cholesterol can also be predisposed to having stroke. People who are obese are also prone to having stroke. People who have large tummies. All of these factors combined can make stroke very high. And then again, there are other factors that people cannot change, like the factor whereby somebody's father has had a stroke. If somebody's father had a stroke, it puts the person at a higher risk of having a stroke himself.
On our perception segment, we appreciate your contributions on how to improve human lives.
we should focus on prevention, and the way to do that is perhaps do a lot of sensitization so people understand how they can catch it and ensure that people don't catch it. I don't like us playing catch up where we keep, trying to solve a problem after it has happened. The best thing is to do things now and prevent it before it becomes a catastrophe.
This is where we'll wrap it up this week. Please join us same time next week for another interesting edition of the program. My name is Oshomowa Daniels. Bye for now.